Ever see someone who finds it hard to recall certain events associated with stress or trauma, making them unable to remember important personal information? Hello, and welcome to the Connected Minds podcast. Today's podcast will discuss functional amnesia, its causes, signs, tips to deal with it, and the difference between amnesia and dissociative amnesia, also called functional amnesia. There are many depictions of amnesia in popular culture, from movies to TV shows to films, and, ironically, autobiographies. All of us have sometimes struggled with recollecting an event from our memories. For example, one might be unable to retrieve visuals or conversations they had during the travel or drive after it's over because they zoned out or were lost, but they reached their destination. This disassociation does not interfere with your everyday life and is therefore called non-pathological dissociation. The functional disorder has trouble integrating consciousness, memory, perceptions, identity, emotion, body representation, and motor control. Functional amnesia is the inability to recall important personal information or memories associated with extreme trauma and stress. It differs from general forgetfulness or absent-mindedness because the episodes are frequent and the parts of the memory missing are too severe. A person suffering from functional amnesia can forget a behavior, learn talent or skill, their name, workplace, etc. This disorder restricts a person from developing a complete understanding of themselves or their self-awareness, or having trouble making sense of their surroundings. Although the information is inaccessible to present consciousness, it influences behavior. During the episode, in some cases, the person is conscious of their memory loss, but not every time. It is almost always confused. What is the difference between organic amnesia, functional amnesia, and functional fugue? While traumatic or stressful events often cause functional amnesia, organic amnesia occurs due to the physical ailments like infections or trauma to the brain. Functional fugue is not different, but a type of functional amnesia with similar symptoms in a fugue state. The person is on the move and finds herself in unexpected places with no recollection of the steps. A functional fugue episode may be longer than an episode of functional amnesia. The dissociative fugue episode lands the person in a different location and assumes a new identity almost every time. What are the causes of functional amnesia? Amnesia occurs due to enduring and experiencing traumatic or stressful events or interpersonal conflict. Dissociative amnesia can also be inherited through genes by the next generation. Traumatic events can range from rape, physical abuse, sexual abuse, natural disasters, war, losing a loved one, and economic hardships. Interpersonal conflict can be guilt, existentialism, unresolvable conflict, or indulging in criminal behavior. As we mentioned earlier, amnesia is caused by the physical ailments. Still, recent studies have shown that changes in the brain activity can help study functional amnesia. What are the other subtypes of dissociative amnesia? Dissociative amnesia can be localized, selective, generalized, or fugue. These are also listed as symptoms in the DSM-V for diagnosis. Localized amnesia means the inability to recall a specific event, or period. These memory lapses are attributed to trauma and/or stress. For example, a person has no childhood memories of being abused, or a soldier forgets his battlefield experience. Memory loss does not occur for hours, days, or long after the traumatic period. The missing period is often clearly restricted, ranging from specific minutes to years. Selective amnesia refers to forgetting events during a particular period or certain parts of the traumatic event. Patients can have both localized and selective amnesia simultaneously. Generalized amnesia, people forget their identification and life, sense of time and place, conversations and meetings, behavior, thoughts, beliefs, and feelings. The person's general knowledge and skill set are also affected. Generalized dissociative amnesia is not that common in the general population. It usually affects combat veterans, victims of sexual assault, and people experiencing stress or conflict. The onset of generalized amnesia is sudden. In systematized amnesia, a person forgets information about a specific category, such as information concerning a particular person or someone close to them. In continuous amnesia, the person feels every new event as it occurs. Is the person with a dissociative disorder aware of their condition? In most cases, patients with dissociative disorders are partly or entirely unaware that they have gaps in their memory. They become aware of their disorder when their identity is lost or because of the circumstances. It is only when people around mention, remind, or question the events that the person finally realizes. This, in turn, affects the person's capacity to form and maintain relationships. Patients may get flashbacks, which may alternate with amnesia episodes for the contents of the flashbacks. Amnesia patients may develop PTSD because of constant reminders eventually. Their comorbidities with depressive and functional neurologic symptoms are expected as other self-destructive behaviors. The patient may become overwhelmed by the traumatic memories after the amnesia episodes and develop suicidal thoughts. What are the treatment options for this disorder? Functional amnesia is not curable, but the treatment options help the individual deal with it and find some semblance. The first step of treatment for memory loss is to create a safe and supportive environment. Treatment approaches for dissociative amnesia are chosen according to the patient's symptoms. With the patient's consent, the treatment can include steps to recovering memories and addressing the trauma that caused amnesia. There are no research findings about the therapies that work, but cognitive behavioral therapy and psychodynamic talk therapies are performed. Cognitive behavioral therapies help address thought patterns and trauma and develop coping skills. Psychodynamic talk therapy helps to explore conscious or unconscious themes that may be relevant to memory retrieval. Other therapy approaches include dialectic behavior therapy, family therapy, eye movement desensitization and reprocessing, psychodynamic therapy, and meditation. The degree of amnesia varies depending on the span of missing memory and needs different approaches. These therapies are usually sufficient for memory retrieval. If not under hypnosis or using drug-induced states for retrieval state can be successful.